Hey guys, Kristen here to share with you today. We're going to go ahead and go over a little bit of low back work. I was thinking about this because I've had Kristen and Danielle teaching and then doing the jam, and then I have a tendency to take things and refine it even more. So for instance, intro to Thai massage is kind of the low back sequence for the mat, and we'll be going over some of that, but in reality, the way stuff looks in session can be a little bit different because I change things to fit my body and then also change it to fit what I think is going to work best for clients. So when you're giving and receiving with your partner, feel free to change things. But Kristen was like helping somebody move earlier.
Yeah.
So your low back was...
Oh, it's excited for today.
Yeah, I figured, you know,
Just a little tight,
when I knew you're moving. Go ahead and just lay down on your back for me.
Okay.
And then I start with stuff like this all the time. I think about this when I'm teaching. You don't want the pillow?
You mind passing me the roll?
Which one? This one?
Yeah, the roll.
And a big part of what I do now is just, you know, flipping camera angles and like showing people exactly what I do in session and like what that flow is like. But because we're, you know, starting, it's very, very common for me to come in and then just start off just like this, because I know that she's been doing stuff with her low back. I'm essentially hooking behind and posterior to the greater trochanter of her femur right into the gluteals. You're going to hit a little bit of gluteus medius, which is on the right side, but because when you look at that left anatomy where it's spinning around, do you see that bony knob on the edge of the femur on either side, just on either side of gluteus maximus? That bony knob is what I'm trying to avoid. When I press in, I don't want to hit that. My foot, I can almost feel it like right next to my foot, but I'm not like, it doesn't feel like I'm digging in bone, right?
No, you're right up against it.
But like we're close to it.
Close to it.
And you'd have to communicate with the person you're working on. Maybe they couldn't take this much pressure. Maybe you'd have to back off a bit. But I'm really using the ball pad of my foot to be able to reach into that area. And then this time I'm going to reach and kind of scoop a little further back. This is one of the hardest things that I teach, and it's because of the positioning involved. This leg is mostly just hanging out, but this leg, it's like I'm scooping and then pressing the ball pad of the foot into the gluteals. Now, it looks easy because I've just done it 9 million times and I don't have to think about it anymore. If we go horseback riding, I'm going to fall off. I'm going to bother the horse. I don't know where to put my foot. Don't know where the stirrups are. My adductors aren't used to, you know, holding on or whatever. You'll learn how to do this, but I think it feels awkward in the beginning, and frankly, I almost think it should. You're just not used to using your legs and feet this way to be able to deliver pressure. How's it on your back, by the way?
It's good.
I do lots of work using the leg as a handle to be able to reach down into the low back and help people with low back pain. A lot of the structures that we're addressing around the pelvis are having an effect on the rotatores and the lumbar spine by mobilizing the sacrum and being able to have those in a position that allows us to access some of the core issues people are having with back pain. If you're not addressing the additional anatomy and you're not addressing the psoas, you're not addressing the gluteals, the hips, if all you're doing is sticking an elbow in somebody's back, I don't think that's going to be as beneficial for the large number of like low back pain things that we see. I was doing some video editing yesterday, and I'd had a little bit of a problem with my low back, and I just had some tight muscles along my lumbar spine, which was that perfect moment that I actually needed that elbow to like sit and hang out and shear a different direction. But for a lot of people, I think they're having different issues with their legs and hip structure that's all wrapped around their lumbar spine. It's causing a problem. Is that funny to you?
No, I'm just, you hit a spot there where I was like, whee!
Oh. You were just giving me this look, and I was like, what's going on? Did I miss something?
No, it was just like a brief moment of like intensity that was totally manageable.
Yeah.
Just made me smile.
This to me isn't what I consider like an advanced move, but I do think that this is really potent work when you're dealing with somebody having low back pain. This is also making the best use of your legs and feet to be able to take pressure off of your hands, which if you're part of a couple working at home and your partner is a big burly guy or something like that, then it would be easier for you to learn how to do this. And again, you can see it from this angle. The greater trochanter is usually somewhere about here. You can usually feel like a kind of a bony knob or protuberance. You want to kind of be above and posterior. And posterior in this case meaning down towards the mat. So I just know how to put my foot in and sort of scoop up. Doing okay there?
I'm smiling because I'm doing such a good job.
Or is it
with
just
cameras.
tender?
No, it wasn't anything. I was just like, boom, I got that shot. Camera 1 is where it's at.
And if they start to shift, move, I don't even worry about that. There's a reason we got these big, nice mats. These are easy to clean off and wipe down after session. They're also highly functional. You can fold them up, just set them against a wall or put them in a closet. These are the ones I highly recommend to students because I just think they have the most pushback. They're soft, but they've got enough pushback where when you're doing a compression, you don't feel like the person's just sinking away into the mat. I'm going to reach a little further back this time. Not too much there.
No, it's good.
How's that on your back, by the way?
Feels great.
Good.
You feel it in my SI joint?
Now, on the outside, it looks like I'm just working on the leg. Also, I think this is one of those movements that people don't quite understand because if you've never had somebody do it to you, you don't know what it's supposed to feel like. And just adding some around the IT band there. Doing all right there?
Hey, I'm good.
Your yoga pants, you're sliding away.
It's okay. It's okay.
I'm gonna take Kristen's leg, and she thinks I'm stretching her, but I'm really dragging her back to center. How was that?
That's so therapeutic.
So, you want more of a twist this way?
That's nice.
Okay. So, even though my handle is here and I'm pulling the leg, what I'm really trying to do is lengthen all of those facet joints. And I know Kristen well enough to know that her SI joint is like an ongoing issue. And then, Kristen, if I were gonna take this, so I'm gonna add some stretch. What do you think about there?
That's nice.
Okay. Now, do you want me to go up this way?
No.
Or do you want me to go a little down?
Down.
Now when?
When?
Right there?
Yeah.
Okay. Now, if I give you a little bounce right here, how's that?
Nice.
That little clunk in your ankle, is that comfortable?
Yeah, it's fine.
Okay. And where do you mainly feel this?
Right here, middle of my back.
Yeah.
Right SI joint.
Now, because she likes this pull and that little bit of bounce, I'm standing up. I'm trying to figure out how to do this with a little bit more oomph. So I'm going to come down and see if I can do this. I'm going to see if I can loop around her calf here to get some support. How's that?
That's nice.
Does this feel like it's not as beneficial as what I was doing
Is that
before?
way easier on you?
Yeah.
Oh, it feels great.
But I can hold this, and then if I hold and then rock from there, how's that?
That's great.
There we go. Now, I'm holding her leg. Is it too much where my knees are hitting you there?
No.
Okay. But I'm really trying to work on the lumbar spine. I'm really trying to open up those facet joints on one side. And what if I maintain right there?
That's good.
I'm going to unwind just for a second, just to give that part of her spine a little bit more of a break. Then I'm going to bring her up. There's a little bit of a hamstring stretch, but I also want to explore sort of tucking the knees towards the chest to be able to change the position of the sacrum. So I'm going to do this one leg at a time. Like if I bring you up and over, do you want to go lateral or do you want to go more towards the...
Yeah, lateral.
A little more lateral?
Psoas.
This way?
I like that better.
Now, as far as pressure, if I put you in my holster right here, is it more like this?
Oh, yeah.
Okay. Now, do you prefer the rocking, sort of rocking in and out?
Yeah.
So again,
It's really tight.
it looks like I'm pressing just on the leg, right? I'm using the leg as a handle to mobilize the lumbar spine. This is where most of the work is coming from.
The hands just make it more intense.
Just gives a little bit of pressure into the adductors, a little bit of nuance.
Yeah.
But most of the pressure is delivered just from body weight. And what do you think? Hold right there?
Oh no, don't hold. It's too tight. You can't handle it.
So again, all down through the lumbar spine, mobilizing the sacrum, right? You're working through there. In addition, when you're going through the QL, the psoas, you're mobilizing all those structures that wrap around the pelvis, wrap around the hips. And then when I first brought her leg up, it was more like the hamstrings because the hamstrings were getting a little bit of length when the leg was up. When I come down to right here, it's just giving her enough pressure to open that as she dies.
As she dies.
Slowly. Now, if I take your leg up and over now, and this one is the one I was kind of building up to. This is very beneficial for people. I'm just making a really big circle with the leg. So I'm going to give her a choice, okay? So I can bring her up, kind of knee to same shoulder, knee to opposite shoulder. Where do you want to go?
Knee to same. Ooh. You do that whole twisty thing.
There?
No, I like opposite.
Okay.
I like.
Up and over?
Yeah.
Okay. Now, if I'm going with the knee up towards this opposite shoulder, what happens if I go a little bit over? Is that more beneficial?
Yeah.
Okay. So I'm having to find out from her what works best, right? What I'm going to do is come up, and since I've determined that I can cross her over, I'm trying to make this as easy on my body as possible. So if I bring you up and over, do you need more up or more down?
Up.
Up till where?
There.
Okay. Now, because of my height, my leg is long enough that I can do this. When I bring you down and over, how far over do you want to go?
Oh, that's good.
Okay. Or do you mean to rock in and out?
In and out, it's always good.
Okay. In the Intro to Thigh Massage workbook, and this isn't an error, by the way, this is just like how the curriculum works out. I show knee to same shoulder, knee to opposite shoulder, because I thought it was clear. We're just mobilizing the hip to access the lumbar spine.
Yeah.
Guess what the students get fixated on?
Yeah.
Well, but how close to the shoulder do we go? And I'm like, well, it depends on their hip mobility. And they're like, oh, like they want it standardized.
Yeah, it can't be, but everybody's different.
But this is a modification of what's in the workbook.
Yeah.
And it's easier on my body. I'm able to rock in and out repeatedly, and I'm not straining my hands while I do it. How's that?
It's nice.
Right into there?
Mm-hmm.
Okay. You want some pressure in here?
Sure.
You want some pressure in here?
Sure.
Too much?
Nope.
Is it helping?
Sure.
Because now that I've got this leg over here stacked, I could actually drop this guy in and get some gluteal pressure if I want. How's that?
Nice. Whee.
What are we?
Oh, that feels so good.
Is it more the rocking on the gluteal or the movement of the leg?
Both of it.
Both of it. Okay. So, because of our time constraints, and I've only worked on one leg, I'm going to slowly unroll this guy and then traction her. How are we doing on time?
You're doing great. It's perfect time to switch at 7:17. You started about 2 minutes after, so you're kind of like right on time.
Yeah. So, one leg, We started with like gluteal on one side, gluteal on the other. You generally want to address both. Some people are going to prefer a little pressure to one side or the other. I'm just going to bring her up over here, just like before. And she can have a little bit of bend in the knee. It really depends on how tight her hamstrings are. I want you to feel free to allow the leg to bend. They're still getting some length. It's just like doing a forward bend in yoga. You don't have to keep your legs straight. You can bend them and just straighten them as much as you comfortably can. So bring you up. And then a little bit over. Is that preferable?
Sure.
Okay. Feels good this way? Okay. And from here, I'm going to free up my hands so I can grab hold and give her a twist. And you like the rocking in and out?
Yeah.
Okay. In my case, just like before, I'm going to drop down. I'm going to see if I can get a hold right around the calf here, and that way I can protect the knee joint. How's that? Mm-hmm. Okay.
You should just let me rock the cameras. I was killing it. Thank you.
Just depends on what I'm doing, where I'm moving.
Killing it, man. Let's see if things. Yeah.
If it feels better to you to do this from a standing position, do it from a standing position. Right there.
Oh, I see what happened. I was wondering where that one was over there.
There is no one up there right now. Whoop. Then, just like before, I'm going to let her bend. And is it a little more lateral like this? Because we're generally just bringing her hips through a range of motion. Now I've got it hooked in the opposite holster here. Most of the movement comes from hips. How's that?
Yeah.
Okay. Not too much in the adductors?
No.
80% of the low back pain that I see in clients, I would address with a sequence that looks remarkably similar to this, depending on what they report to me.
Shiitake.
Too much?
Tight. I need the yoga. Oh.
We gave her some lateral rotation, right? Now what happens when I bring her up, over, and across? Because I'm just bringing her hip through a range of motion to find out what she likes. If I go up and over, is it just like the other side, kind of
Nice.
like in there?
Yeah.
Okay. So it's like free, free, free. Aww. The Amityville Horror, the Crypt Keeper. Once you sway the door and you feel like where it needs to be greased, that's where you're going to hang out, kind of over there.
Yeah.
So for her, it's not really knee just to opposite shoulder. It's a little further along. So when I bring her up and over, it makes it easy for me to step through and go, listen, right there?
Yeah.
Okay. Now is that too much?
No.
Because this is easy for me to do. Modifying things to make it fit your body is something you must absolutely do. A little further over. And then what do you think back there?
Oh, that's lovely.
Oh.
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 Tight.
Now, one of the things I did not talk about, press number 9, is herniations and bulges. Somebody has an old herniation, go slow. Bring them through a range of motion, see how they respond. They have a fresh herniation, don't twist them. Just generally speaking. Go back to camera 4. There you go. Generally speaking. Am I killing you?
Yeah, sorry, I forgot about the cameras because
Are you dying?
of my butt. Yeah. Whee.
what do we, right there? Is it too much? Okay. Then I'm going to slowly unwind her again. And we've mobilized the pelvis. We've accessed all the lumbar spine, but how many times have I touched the low back?
No.
Exactly. But the client would get work like this, and then if they had a really bad low back problem, just achy sacrum, I would sometimes stop, like put them down, and then go, hey, stand up for me, like walk around. And then like find out how they feel. And 9 times out of 10, after 30 minutes or an hour of this, they're like, oh my God, it's gone. Yeah. And it's like, yeah, it's just some tightness like wrapped around this pelvis area. Do you want to turn on your front for me for a second?
Yes, let's do.
Because easy to use stuff anybody can use at home to be able to help a loved one who's having problem with their low back. So now we have her prone, which means it's much easier for me to come in and deliver pressure right into the gluteals. Now in her case, because we work together all the time, this could be super nuanced. I could change this in myriad ways. Do you want me to go a little bit higher? A little more lateral?
Oh my God, all of it.
All of it, okay. So all the stuff around the gluteals is tight, all around the sacrum. What if I'm on top of the sacrum and like leaning down?
Nice.
Okay. But you kind of prefer the gluteals?
I like anything.
Anything. She just likes attention.
I do like attention.
She's like, take care of me. So this right leg is just planted. The left leg is just hanging out. It's soft ball pad of foot pressure just to rock this open. To me, in a sense, it almost feels novel, or not novel, like a novelty. Like for me to think about what I do and how simple and easy it is to deliver, people are really surprised that I get such profound results for clients from using such simple techniques. But it was always trying to make it better for the client and better on my body, so it was easier to perform. You dying there, Kristen?
No, I'm going to heaven. I guess I'm dead.
Now, we did one side. I'm going to go back to the other. She's slowly going to slide back the other direction as I do this. And same as the other. It's kind of like all along the sacrum, all good spots.
Tight ass. Apparently.
All these years of work, still tight ass. If I was going to use forearm elbows, I would use forearm and elbows after I had softened these structures using my feet. It's very, very common for me to see people using elbows in people's gluteals when I feel like because they don't use their feet as tools, they don't have access to a broader range of tools. So they go to the tools they have, which are more pointy. My tuchus tightens up just at the thought of somebody leaning in, giving me pressure
I know, right?
with the elbow.
Tracing your body with elbow. Oh.
I mean, when you build up to it, because I had a problem with my low back, and the elbow was a perfect tool because it was just the right size to like sink into that groove and allow me to get that stuff worked on. But these muscles are so small. If you're focusing on a very specific one, sure, elbow's great. If we're doing what I think of as like general work to be able to soften tissue, I think that it's completely fine and preferable to use the legs and feet first. This is much easier on the giver, and then also I think it's easier for the receiver to take this on. If I then decided I wanted to come down and deliver some sort of elbow pressure, it's very easy for me to now come down, take an elbow and then put some pressure like along the sacrum, because it feels like I've softened the area with a bigger, broader tool. And now I can do a little spot like cleanup work. So if I hook right there and shear down, or up?
Up.
Up. Tell me when.
When?
Right, okay. Now, more to the midline or more lateral?
Midline.
More to the midline and still up?
Right in there.
There we go. The reason I ask those questions is because she's telling me where to put my elbow. It's almost like I'm grabbing, if I use the shirt as an example, I can grab a section of skin and then go, do you like this direction? Or, oh, right, oh. When she tells me that, I know I've gotten to that sweet spot, that spot that the massage therapist hits that you're like, oh, please just hang out right there. Now what about some rocking? Right there.
Oh, it's sharp.
Not too sharp?
It is sharp.
So I'm gonna broaden it just a little bit. A little better?
Yeah.
There you go. And this, again, I would only use this after I had done that basic work to like get the process started. For lots of people, the lower back work that we showed just from working the gluteals that way is really gonna open this whole area up and allow you to get some really, really great low back pain relief for the 70 to 80% of just generalized low back pain that we see in practice every day. People who sit in chairs, like how much movement do they get through their hips and pelvis at all?
Not much.
And I do more of it now these days as well because I'm doing constant video editing. But it really starts to allow the sacrum to snake back and forth and move around so that those facet joints open up and some of the tighter musculature along the lumbar spine starts to let go, unwind, and sort of snake around, I think, the way it's intended when it comes to movement. It's very easy techniques to deliver. Once you get used to using your legs and feet, you don't want to not have these tools available because you're really going to save your hands being able to work on people this way. How are you doing, Kristen? You dead?
Mm-hmm.
We mentioned herniations briefly. It's just a matter of safety. Again, old herniations, not that big a deal. People adapt, adjust. Even having a herniation doesn't mean it causes pain unless the herniation is actually pressing on a spinal nerve. That's when it could be really bad. People have to have surgery and things to clean that up. Oh. And just coming back around just to soften either side. How you doing? You dead?
Yeah.
Mostly dead?
I could lay here all day.
Those sessions are only 3 hours.
That'd be nice.
And just to give her some balance for balance sake, I'll come back over to this side and see about the elbow along the sacrum there. And from there, is it leaning down or up?
Mm-hmm.
Okay, tell me when. Kind of there? And then what do you
Up.
we think? More lateral, more medial,
Whatever, they're both good.
and then up.
Yeah.
There you go. If they don't have a preference between left or right, I just kind of go to the center. Right in there. And what if I give you some rock there now? Or is it better if it's static?
I like rocking.
What about this instead?
That's nice.
There you go. That's nice. So I could make all sorts of assumptions. And in the end, it's just so much easier when she's like, that's nice. That's what she wants. She's conveying and communicating to me that that is the pressure that she was looking for. Me, I'm just exploring movement and trying to make it as easy on my body as possible. But she tells me, that's it. That's the spot. That's the one I want right there. And she's dead. You ready to trade off?
No, I think you should just give the whole time. Since
Oh, that's how it works, huh? Yeah.
No.
Yeah. So we'll be back in just a second. You guys can take a bathroom break. We'll give you just a brief
Convince your receiver to do
Not a
some work.
brief transmission. What do they call it? What are they? A brief
Transition?
intermission. That's it.
Oh.
A brief intermission. That's
Brief
like, it's not a
intermission. Please
transmission.
stay
That's in a
tuned.
car. We'll be back in just a second.
All right, guys, get your partner back on the mat, and we are going to get on in with the work. I got Robert here in the middle of the mat. He's got his knees up, no big deal. Just give a little traction. You were saying you were having some low back stuff this week?
No. Most of my stuff was just from inflammation from like cheating on the carnivore diet. I haven't had any problems since I did some work with the maw roller on my lumbar spine to address those muscles that were tightening up. I think some of it was also coming from just excess sitting in a chair.
Oh, nice.
Doing, like video work.
So sometimes you'll have a receiver, or maybe your friend won't like as intense of a softening here. So I was kind of showing you how you can just use the ball pad of your foot, do some gentle rocking. It's not quite as intense, but it's a great place to start. And for some people, that's all they really can handle. So I'm going to scoop up with my foot. My left foot here is just hanging out. Robert, is that good pressure for you? And the hardest part students have with this move is really the way their right foot's going. And I don't know, it's an awkward thing. Like Robert said, if it's not awkward, you're not doing it right, I guess. Because once you get the hang of it, it's like second nature, you know. But at first, it's really weird, and this is one of the hardest things to learn.
Yeah, if you're not used to using your feet, it's all weird.
Yeah, but I mean, even it's just it's like rubbing your stomach and, you know, hitting your head at the same time at first. So I went a little bit deeper. My right foot's really just kind of hanging out, keeping him in check, I guess. Giving him a little cradle there. So as I come down to kind of adjust his IT band, I'm using my pad to roll him up. Be aware that if your feet are very bony, this bottom foot here, it might be easier for you to have it, well, easier for your receiver if your foot is at an angle rather than straight up and down. But, you know, just talk to your receiver. If they're saying it's too sharp, adjust your back foot. And also, you don't feel like you need to hold them so hard. This is a pretty intense move here in the IT band. Rolling up with my pad. How's that pressure there, Robert?
And yeah, no problems in my low back, but it still all feels great. Just to have it worked on.
I don't know, I can't be here and not do this, where I kind of slide up his leg to where it's bent. So I'm going to come in right at the top of the leg. Does that feel good there, Robert? And I'm coming in with a flat foot. If your receiver wants more pressure, come in with more of the side of your foot. That's sharper. Man, I was really trying to pay attention to which order you did things. I think you did both hips first.
If you do it out of order, I'll explode.
Don't do it.
If you do it out of order,
He's going to
messes
combust.
the whole thing up.
Everything's ruined. She did it. So I'm gonna come in here and scoop. Whee! Sorry, I had a foot cramp. Foot cramp on the scoop.
I get them every so often. I also don't think about it much, but I suspect I have very flexible but strong feet.
Mm-hmm.
Because of, like, doing all this all the time.
Oh, for sure you do. I recently injured my foot about 3 weeks ago, so I don't have quite the stamina I once did for now, as I'm in my healing. Doing good, not pain, but just still kind of recovering.
Just stiff?
Yeah, I feel like a cramp right here.
Yeah.
Basically, it's just like all these muscles got tight. No actual damage to my bones or anything. And come roll the IT band.
And this is the Princess Bride. Gently.
Watch your receiver's body language as you're doing this, because the IT band is very tender. You received this a minute ago. You know what it felt like. Be nice to your friend.
Well, the access to the feet, there's if it's done well, the arch is so broad, it like wraps around. But I couldn't imagine somebody taking an elbow to this.
Oh, the elbow side IT band is like, do you hate me? I thought I was paying you money.
You always talk about the elbow to the calves. I'm like, ooh.
Oh God, they do it. I've received a massage one time where the guy tried to literally trace my entire body, every muscle with an elbow. That includes the calves, everything. Better believe I did not return.
No one expects the Spanish Inquisition.
I'm like, what do you want to know? I will tell you anything. Please stop. This really hurts. I'm not relaxed. So I'm bringing his leg up to where there's a slight bend, just so I can get right up here to where his leg meets his body. And meets his body.
Yeah, I don't walk around and feel like I need work all the time, but it always feels super nice when I get it.
Oh yeah, for sure.
We work in the field. I can't imagine what people who say,
Ooh.
I've never had a massage. I'm like,
How do you live?
I don't even know.
Like,
I couldn't admit.
how would you exist?
I wouldn't be 45.
No.
I would be gone.
I'd be gone. No more. Sorry, he didn't make it. He never received any massage. All right. After this, I believe you came up.
Yeah.
Is this where you came up in?
Yeah.
Wonderful. So I put Robert's foot in my holster. Just this nice little, sorry, I'm having some mic difficulties. There we go. We're just gonna put his foot here. I don't have to say if your receiver did not have a lot of mobility, if they were pretty stiff, you don't need to do too much else. It'll be a lot. But I know Robert is very mobile, very flexible.
But see, I barely feel it on my legs. It's all on my sacrum and low back. It's like you worked on the glute stuff like first because of legs. And then when you get into here and mobilizing, it's like I feel that super deep, like in my sacrum, down in my hips. It's like mobilizing all through the pelvis, the lumbar spine.
So you'll see my right hand is kindly, gently, softly. I mean, is that soft? It's not aggressive. I'm not pushing the muscle into the bone, or I'm trying not to.
I'm appreciative.
Yeah, I'm just going back and forth, kind of like the waves,
I would
right?
be like, no.
I'm not forcing him open. I'm going back and forth. Just a gentle rock. Because Robert's my friend. I'm not trying to crack him open. I noticed in class when the students were doing that, and I was like, whoa, man. I was like, don't crack them open. Let's be nice. A little flow. So here's where you were talking about. We go in and give a little movement. Do you like it when the leg is more towards the same shoulder or
A little more to the
opposite?
Yeah.
A big loop.
There we
Oh,
go.
a nice pop.
I had a spontaneous cavitation.
As I'm doing this, I'm making sure to protect my back and myself. So I'm leaning with Robert as I'm doing a nice big twist for his low back. See, here's where I was like, I don't normally do this. I knew you were down. What were you doing? It was like this. What were you doing? Was it like this?
I was grabbing around the calf to traction full on the sacrum. There you go.
So I normally do this the harder way.
Which is
I normally do this
standing up.
standing up. Which
It
when you
depends on the person.
But this always bothers my SI joint, my low back.
When you stand?
When I'm standing and doing it, sometimes I don't know. I've got issues. So for me, right? That's the way I normally do it. This is the way I just learned. I think I like this better.
And I like this for some people too because you're taking the knee out and taking
So
the
if I am grabbing you by the
hamstrings
knee.
out of the equation. You're not stretching over as many joints now.
Yeah.
So like sometimes, what if somebody had old ankle injuries and you can't hold it?
Ah, true. This is so much better. Do you like it better when I'm pulling down?
Yeah. And I get this nice like TFL kind of lumbar spine, like all this rocking through my sacrum. Feels
I just
super
feel a
nice.
lot stronger doing
But
that.
I'm also getting some like hamstring stretch because you prefer this.
This is also another way I do it.
But it's also because my hamstrings are open enough to do this. People watching this are probably like, I can't do that.
I can't do that. I can't do that. Well, I like this one as well because I like to stretch while I'm working on my client.
Adds more hamstring
Yeah.
with the added to the hip and like lumbar spine.
So my hand being over my knee, I feel like that is not a good thing. I feel like it should be down here, correct? Does it bother you being up here? I would say it's
no,
probably...
I like it.
Okay.
But I think it's also because you're grabbing on either side of the joint.
Yeah.
So it feels like I'm supported around the joint. If you're just below or just above, they have a different feeling.
Yeah.
She's like, no retreat, no surrender.
I was like, what did we
Right
do?
into your calves,
I guess you
right into
started
your
here.
hamstrings.
This is where you started and you went over to that. Yeah.
Well, it's also just exploring range of motion. Seeing where people's bodies allow them to move. Allow them to mobilize.
You can do the elevator. Whoop. As long as your client's a noodle, you can do that. You got some controlling client, they can't do that. Where do we start here? What are we doing over here? We did that. Ah, we coming in. We'll come in. Start off where we left off. Throw in some little bonus stuff and just, you know, check a little range of motion, giving a little foot action here. You like it more to this, or do you the same opposite shoulder on this side as well?
Nah, I just got to go through a range and see.
Let's range them out. Put them in our holster again, y'all. I'm coming in and seeing Robert has really great range. Duh. We knew these. Come and give some rocking compressions. Changing my weight between my hands as I'm rocking. Give some nice mobilization to the lumbar spine. You could do some more focused here. On the adductors, give them a little pressure.
And my adductors are the ones that they never feel tight, but when you apply pressure, I'm like, ooh,
Ooh, yeah, right?
And I've never been able to figure out why. Because it's not an area that like screams at me.
Mm-hmm. Just like hiding the information. Let's see what's going on this way. Robert's got these little fisherman pants. I'm just trying to get my toes underneath them. Typically, whenever I do this motion across, I can slide myself in a little closer to protect my back. I'm short with short arms, so you tall people, you might not need to slip on in. But for you shorties out there, protect your low back and rock with the body. If you feel yourself reaching across, get on a little closer. And so whenever we're doing this big circle, we're lifting the booty up off the mat. And as you feel this, you'll know that this is like the best spot right here. Oh, that's the good stuff. So we don't want to cut that out for our clients, receivers, friends. I'm going to challenge myself and not do it the same way I always do it. Woo, for all you, this is weird. It's like writing with your opposite hand. Let me see. There you go. How's that feel? See, I like this way better because I feel like so much more in control and like stronger here. But I also do like it for the fact that like the ankles, you don't even have to worry about pulling an ankle because most people have twisted or sprained or messed those ligaments in their ankles if they're over 20, even below.
I'm actually amazed I've had as few injuries as I have over the years. Like, to my knowledge, I've never broken a bone.
Well, when you're staying out of nature, it's easy to not get hurt.
What is nature? When are we
It's
apart
that
from
crazy
nature?
place out there.
If you're not doing extreme sports, likely.
I just want to give Robert a little, this is working the piriformis a little bit. My hand is literally just resting. I want to distract you. This is literally all on the lunge. Now I just like to hit that point, which I know I'm not hitting with Robert, but with your receivers, you want to take them right to that edge and then slightly back off. And slowly come out. Let's go ahead and flip it. I didn't miss anything, did I?
Say it again?
I didn't miss anything, right?
No, I don't think so.
Cool. Let's flip it. So I'm just going to come stand. You got one of my eyelashes on your bottom.
Nice.
I'm going to come stand at Robert's hips. And you could use whichever foot you prefer. For me, I like the way the shape of this foot is. The way it shapes into his body. It's a perfect little fit. I was just looking for the tension. Robert, do you like it more higher or?
More in there.
More in there? Yeah, I can feel that. Yeah. So for me, I could feel that I was a little unstable. So instead of being all wobbly, I'm just going to come to a better spot and go back in. You can put your hands on your hips. Whatever you do for balance, as you do this, your balance will get a lot better. But really like rocking him. You see, I'm not being rough, but I'm not being delicate with him. I guess I am being rough, but it's a good rough. We're being very intentional with this glute compression and rocking. My leg's getting tired, so I'm gonna switch feet. No big deal. If anything ever feels wrong to you as a giver, don't do it. If anything ever feels wrong to the receiver, also don't do that. Our bodies know what is good and bad for the most part, so if we just listen to it, save us some trouble. So I'm rocking Robert, and when I find something yummy, something nice and dense, just kind of lean in. You can see all the muscles that are being affected by this rocking or loosening. If your receiver wants more pressure, you lean over. How's that pressure, Robert?
Yeah, that's good. I can't take any more though.
No more.
It like lights up down my right leg.
So I just leaned, I came back just a little bit.
It's like this dull ache.
Using the pad of my toes to rock the QL. I'm very aware of the floating ribs. I'm gonna come over to the other side and soften it up. You like it more up in this area, Robert? More down in here. Number 2? Number 1?
First.
Yeah. I feel that.
It lights up again.
Pressure okay?
Yeah.
It's like I feel a band and it runs out to the lateral side of my foot.
It's likely just sciatic nerve
Yeah.
stimulation.
I'm gonna bring myself a little closer. I can feel myself kind of sliding back. I'm gonna switch my feet. My calf was getting a little tight. Come rock his QL. We have a couple minutes left. I really probably normally would have started down here to give a little compression up the body, but that's where I'd rather go instead of putting an elbow in the SI. Just rocking compressions.
It's always one fly.
One fly. He wanted to be the star. I'm using this part on my hand. Knowing that the calves are very tender and tight, so I'm staying a little far behind them. I'm gonna go ahead and bring my body up to be closer to Robert's body so I have more control. I'm not straining my low back. And come up into these hammies. I'm just going to palm press up to where the hamstrings meet the glutes. Rocking side to side as I press up. Then I put my hands on outside of Robert's hips, bring my knees up. I'm in this little squatting position so that I can place my knees right where the glutes and the hamstrings meet. Take a deep breath, Robert. And I'll come right above the hips into the QL. I like to follow their breath and do my compression as they exhale. Deep breath. And do a little cross-body stretch. And deep breath in. And deep breath. So we have these muscles on either side of the spine called the erectors, and that's kind of what I was hooking into on either side of the spine, not pressing down on Robert's spine, of course. I'm just going to do a couple of compressions here just to say goodbye, because today's focus was low back, but you know, it always feels really nice. Let's get a little compression here. And slowly come out. And ta-da. How are you feeling, Robert?
Good.
Well, we're so happy you guys joined us today. And I hope you guys can take some of these moves and work on each other at home and loosen your low backs up a little bit. If you guys are interested in learning more, please continue to tune in. We do these live from time to time, but we also have a whole playlist on Robert's YouTube where you can see everything that we've taught thus far.
Good. We're good for today?
Good.
Cool. We'll see you guys again soon. Thank you for tuning in.